Hello. Thank you for joining us about two small but important updates to our California Child Care program. The State of California EMS Authority has added a couple of topics that they want us to cover with the students in our child care courses. The idea is to help save lives and make our child care settings even safer. So based on new research and new information, they have added a handout for electronic cigarette, concentrated nicotine poisoning hazard for young children, and new information and resource links regarding shaken baby syndrome. And they've given us two-page handouts to discuss and share with the students in our child care classes. In the California Child Care First Aid module, we'll be adding this in under section Activity 5, Caring for Other Injuries, in the area on poisoning. So this is an example of what your instructor manual looks like. So this is what you want to look for. All you need to do is take your current instructor manual, go to that poisoning section, and add this note. It's highlighted in red to make it easier for you to see. Discuss new information on dangers of electronic cigarettes and concentrated nicotine to children. Provide handout. Again, this is a sample of the handout. It's actually 2 pages, so this is just the beginning of it. Make sure you go over it thoroughly and you feel comfortable discussing with your students. We do want to make sure they are aware of this danger so that they're not exposing their children in their centers to something that might harm them. In the California Child Care Preventive Health and Safety module, we'll be adding a little bit of information in Activity 12, Recognizing and Reporting Child Abuse, in the section under Shaken Baby. Again, this is a sample of what your instructor manual looks like. You just go to that section, and under that third bullet there, you see that you provide Shaken Baby Syndrome handout and discuss the language the providers can use with their parents and the additional resource links. Here's a sample of the beginning of the Shaken Baby Syndrome handout. It again is also a 2-page handout. It has 2 links to some great information, extra information that we don't have time to cover in our courses, but they can use as a resource later. And it gives them some excellent language that they can use with the parents and other caregivers when they are dealing with those very, very young babies and infants, and the crying seems to go on and on. It's easy to lose control, and this gives them good tools and good knowledge in order to help prevent the urge to shake that baby. So make sure you go over this and feel comfortable delivering it. As far as logistics for our child care classes, what we are doing, we'll talk about authorized providers and LTPs in a moment, but what we are doing is we're working to get those handouts to the facilities where we provide the California Child Care training, but not all of the facilities will have the new handouts ready to go on the start date, and the start date is Monday, February 23rd. So attached to the email that you received, there are copies of the handout, so please make copies for yourself if you are teaching in the next few weeks to make sure you have the information and are prepared to deliver this important information. We're updating the student handout CD-ROM to include the handouts, but it won't be available right away. We will be using up the the current handbooks that we have at the moment. So the new CD, so you can tell the difference, will be marked with a V.2. For our CPR and first aid classes, again, this is paid and volunteer staff, the students need to view the electronic cigarette danger to children, but they don't necessarily need to take it home. So please make sure you have 12 copies with you if you are teaching the week of February 23rd. We'll have those materials in-house for your use in the California Child Care binders by the end of the week, but it may not have been done as early as Monday or Tuesday. So make sure that you have those with you for that week. All new participant manuals and CD-ROMs purchased going forward will have the handout, and again, it'll have that V2 on it so that you can tell which is which. Participant manuals in facilities currently will be used up until we, exhaust that supply. For the Preventative California Child Care course, the students need to take home a copy of the Shaken Baby Syndrome Resources and Information handout. That is a requirement of the state of California. So please bring or make copies for your class if you are teaching the week of the 23rd. All new participant manuals and CD-ROMs will have this handout going forward. Participant manuals in facilities currently will be used up until we've exhausted that supply, and then they'll be switching to the new CD-ROMs. Again, look for that V.2 to make sure you have the new CD-ROM. Once we have the new CD-ROMs in place, you will no longer have to make extra copies, or the logistics team will no longer have to make additional copies for the students. It will be on the CD-ROM, and since they are taking that home with their handout, that is good enough, and they can make copies for themselves or they can view the handouts on their computer. For our wonderful authorized providers and licensed training partners, again, the students in your class need to view the electronic cigarette danger to children, but you can use a library set. The students must take home a copy of the Shaken Baby Syndrome Resources and Information handout. So make sure you have enough copies until you get new participant manuals with the new CD-ROM that's marked V.2. So please plan accordingly and make sure you have what you need to teach the class so that you can present and hand out the information that is required to go home with the students. Thank all of you so much. We really appreciate what you do. By providing this training, you are doing a good job of making sure our child care providers know what to do to make their child care settings safer for their children. And this is appreciated by us and by the state of California and by our community members. Thanks so much also for helping us keep in compliance with the state of California so we can continue to be a preferred provider with the state, and we can continue to provide this training to our community. Take care. Thanks.